My name, Mary, is short for Mariama, my grandmother who became widowed at a young age, but bravely persisted to create environments necessary for her 4 kids to access opportunities in a village in southern India. Their only daughter, my mother, took those opportunities to become a nurse and bravely immigrate solo to America. She confronted housing and employment insecurity, language barriers, and health challenges to create environments necessary for her family to join her 2 years later. I grew up in this immigrant home, learning how these women created environments necessary to pursue a good life. They were flamingos in a flock of pigeons, cycle breakers, if you will. I know because I became one too. Here's how. When I became an occupational therapist 20 years ago, children's health was no longer defined as absence of disease, but rather a state of being occupied in activities they need and want to do to orchestrate their lives. I grew restless with curiosity about engaging families struggling to support their child's participation in seemingly ordinary activities, things like mealtime, bedtime, and bath time. All too often, families declined long conversations about these types of struggles and passively designed practice solutions. So I became a flamingo in a flock of pigeons by challenging the assumption that this type of problem of practice could best be solved in practice. I chased my curiosity into a scientific space, and it was here that I learned how to team up and rigorously tinker with solutions that led to the birth of Participation in Environment Measure, or PEM, a suite of evidence-based and versatile tools to strengthen services and save resources on otherwise long conversations that would be etched on sticky notes. Caregivers completing an online PEM survey disclose what their child's participation looks like, what they want, and how they strategize and create environments to make participation possible. Caregivers choosing to keep going with PEM Plus spend less than 15 minutes more to map out an initial action plan with a top priority, ideas for specific goals, and a shopping cart, if you will, of potential strategies. PEM, of course, generates reports for practitioners that are tasked to design a service plan, but PEM also generates data for program and system leadership tasked to improve service quality. This research has so far attracted NIH, AHRQ, NIDLR, NSF, Foundation, and sponsored contract investment. PEM surveys are nationally endorsed as an NIH Common Data Element and internationally endorsed in Australia's Disability Insurance Scheme. We get to team up with practitioners and researchers in computer science, health services, human factors, and informatics, while striving to break through in finding these types of partners and resources to scale this type of applied health science to Illinois. This brings me to my dream, as we all need dreams to keep pushing forward. I dream that one day PEM tools are baked into electronic data capture systems to routinely collect the patient-reported outcome of a child's participation. This is a win for parents who complete PEM on their terms, perhaps in their PJs after catching the live show of their child's struggle all day long. They get an intelligent buddy and smart functions for a fast and unique PEM experience. It's a win for practitioners who get that PEM report signaling that families are prepared to co-design their child's service plan. And as parents sleep, program and system leadership also win, as they get the same data safely pushed and combined to discover solutions for PEM and service improvement. Dreams like this need teams. So I created the Children's Participation in Environment Research Lab. Our 30-plus trainees, including a next generation of scientists, bravely tried to arrive to our 3-room suite and create the environment necessary to mentor and sponsor across difference and pursue interdependent breakthroughs as a research ensemble. Our trainees progressively lead research teams to discover new populations with unmet need. These could be children with craniofacial differences and those surviving critical illness. But they also discover novel methods to strengthen and scale PEM to new populations and service systems. And they do so alongside talented research-engaged practitioners and undergraduates whose sub-study or spin-off becomes a game changer. So yes, I teach my daughter now how I too became a flamingo in a flock of pigeons, a cycle breaker, if you will, by chasing my curiosity to pursue a scalable, multi-level practice solution that targets child health as a good life, demanding their participation in it. Tag, she's it.